Hello, everybody. I'm Harold George. I'm the Extension Services Manager of the St. Johns County Public Library System. And I'm happy today that with us we have Robin Gren of the Wildflower Healthcare. Hi, Robin.
Good morning. How are you?
I'm doing great. How are you?
Doing good.
Well, I'm going to start off this conversation talking about my mom. She was an RN.
Mm-hmm.
And one of the things that she would tell us about Christmas shopping was that it was easier to budget for Christmas shopping if we did it year round. But the
Mm-hmm.
reason why she liked to do her Christmas shopping early was to avoid the crowds. And when I asked her why she liked to avoid the crowds, she said, because of the germs. So I guess my mom was, very conscious about those sort of things
Mm-hmm.
because she said, that's why you've got so many colds and flu that time of year. Do you think there's any credence to that, or do you think that's just something that made her feel better?
No, I think Mama was right. Anytime you're in crowds, there could be someone who's sick. And unfortunately, one shares to another and on and on and on. And so definitely being out at the holidays when everybody else is out could certainly increase your risk. And so, yeah, I think your mom was probably wise there, just doing it a bit at a time when the stores weren't so crowded and crazy. And she was able to getting her shopping done without perhaps exposure to a lot of other folks that might be sick.
Well, I think we all know we're all very, very conscious of staying well and
Hmm.
staying healthy and avoiding exposure to all sorts of things this year.
Yes.
But I know that you have some ideas and tips that you want to share with us about staying well through cold and flu season and how we can maximize our options for staying healthy. And I would love to hear more about that from you.
Okay. Well, a couple of the basics that I want to hit on, first of all, are hand washing and the use of hand sanitizer. And I think a lot of people are using a lot more hand sanitizer and washing their hands more than they ever have before. But people like your mama and I, who are nurses, we've kind of always done those things because we always know that anything that's handled by folks can carry germs, can carry something that might cause illness. So good hand washing is basic to avoiding all types of illness. And I'm going to use my hands here because just to give a little bit of a show about hand washing. The first thing is to turn on the tap, obviously, and put soap on our hands. And then what we want to do is lots of friction because the soap is not a miracle cleaner. It's that friction that helps to physically knock the bacteria off your hands. So we're going to rub the palms together. We're going to rub between the fingers like this. We're going to rub back and forth on the front of the fingers. We're going to get the fingertips in the palm of our hands. We're also going to make sure we rub our thumbs good and get them clean. All those areas, the back of the hand, all of that needs to be washed. And it should take you 20 seconds. And if you want a good timer, you can sing happy birthday twice. That will give you a 20-second hand washing, and it's longer than you would think.
Right.
But it will take that long to literally, again, physically knock all that bacteria off your hands. And we're going to rinse them well under the water, dry them off with a towel, and before we turn off the tap, we're going to use that paper towel for out in public to turn the tap off so that we don't touch that dirty faucet handle. And that's the thing, again, as a medical person, in my mind, there are things in the world that are clean and things that are dirty. And a bathroom faucet is something that's touched again and again, and we always have to touch it first with a dirty hand. So those are dirty things. So we need to think about those things and not touch them once our hands are clean. If we're leaving a public restroom, we use the paper towel or we use our elbow to push that door open so that, again, we don't get our hands dirty after we've washed them. The other thing that I think is important to understand with hand sanitizer, I see a lot of people just slap it on and walk away, or they brush it on their pants or that kind of thing. Hand sanitizer should take you the same amount of time that it takes to wash your hands and the same motions. So we should be doing all those same motions with the hand sanitizer, and we should be rubbing for that same 20 seconds until the sanitizer is completely dry. That's part of the way that it works, is allowing it to air dry. And it should, again, like I say, take that 20 seconds. Okay?
Well, and if I understand it, people sometimes, we always get in a hurry. It seems like and I'm never sure where we're rushing to, but we're in a hurry.
Yeah,
And sometimes people will rinse their hands off without using soap.
sure.
And I suppose that's better than nothing, but it's not so much, if I understand correctly, that the soap is killing anything, so much that it's helping to remove the germs.
Right. That soap creates a lather that helps raise those germs off of the hands. And again, with the friction, with the rinsing, all of that helps to take those germs off the hands. Exactly.
So antibacterial soap is good, but the main thing is to use soap to remove.
Exactly.
Okay.
Exactly. And plenty of friction.
And lots of friction. Is there any other daily habits that you might recommend as far as avoiding exposure to germs? Or is it, I mean, it's interesting to me that it wasn't that long ago in history that doctors discovered that washing their hands helped keep their patients healthier,
It is the absolute truth. Yes.
more than
Yeah.
anything.
Yeah, it really is. And some of the other habits that I think a lot of kids are learning in school these days, and sometimes I see children practicing the habits better than the adults because we didn't grow up with those ideas. But instead of the coughing into the hand, coughing into your shoulder or your elbow so that if I, do things then with my hands, I haven't got the germs on them. And those kinds of things help a lot. I think in current times too, people are learning some of the traditional social habits we have, like handshaking. Those are things that certainly can pass germs too. So maybe greeting people in different ways, especially during the cold and flu season, can help as well.
Well, something I remember way back in the day when I first started working as a teenager and worked in the restaurant business,
hmm
I saw more of an emphasis on it than I do now, but that might be changing. This is not a criticism so much as an observation.
hmm
Wearing jewelry was discouraged if you worked in a restaurant or in a case,
Oh
at
yeah,
least hand jewelry.
right,
And
right.
I'm often amazed by sometimes how many times I'll see somebody working with food that has multiple rings. And
hmm
that's an area people forget that, removal of your rings is a good idea when you're washing your hands,
Oh
right?
yes, yes, yes. And I was going to say there are a lot of, if you watched any YouTube lately, there's a lot of conversation about not wearing the jewelry because it can trap bacteria under rings and that kind of thing, like you say. Actually, when I'm training with patients, I try not to wear hand jewelry. I try not to wear bracelets either because that can get down into, against my hand and that kind of thing. So sometimes, especially in certain situations or certain times of year, or like you say, with food preparation, or when you're dealing with people who are sick, it's important to maybe avoid that jewelry during those particular times. And obviously, all the time, being careful with food preparation is extremely important, that you wash your hands before, as you're working with food, because some foods like fish or chicken may carry bacteria that if I don't wash my hands after handling those particular foods, I can contaminate some other items. So even in the midst of food preparation, it's important to remember to wash your hands too. And then obviously for all of us to wash our hands before we eat.
And finally, the thing that I keep thinking about, I wear gloves a lot sometimes, and I'm not sure that wearing the gloves is making any more of a difference than washing my hands. But for me personally, I wear the gloves so I remember not to touch my face. It makes me more aware of my hands.
Yes.
Would you say that touching your face or not touching your face is as important as washing your hands?
That's a huge issue, and especially if you've not had an opportunity to wash your hands, because a lot of the bacteria that we take in, a lot of those germs go in through our eyes or our nose or our mouth. So if I have hands that I've touched an elevator button or a handrail on the stairs or a door going into the store, I now have dirty hands, and if I rub my eye or touch my face, then I may contaminate one of those areas where the bacteria can easily enter the body and cause me to become sick. So yes, keeping your hands off your face, and especially if you've touched anything that other people touch. If you use um, any kind of a public facility, obviously that's a time when you want to be really careful. And a lot of people, like I say, they don't think about elevator buttons and just all the things that a lot of times we touch all day, every day. You use the gloves to remind you. As a nurse, I used to ball my hands in a fist. I would hold my thumbs inside my hand. Once they were dirty, it's like, okay, you don't touch anything.
Right.
Because I used to work in isolation rooms where, you might step in briefly, and it was my way of remembering, don't touch anything. But yeah.
Well, I worked with a lady for 16 years, and she was known for her habit of washing hands, and she would always carry a napkin for door handles and things like that.
Mhm.
And sometimes we used to tease that maybe she was a bit of a germaphobe, but in those 16 years, I never saw her with a cold.
Mhm.
I wish I'd had 16 cold-free years. So
Yeah,
I think she was doing something right.
it makes a difference. It definitely does. And what you're saying about gloves is true. When you mentioned that earlier, having the gloves on, they're not a magic protective barrier. If, again, I touch a pen that someone else has touched, or I've touched other things, and then I touch my face, or I go into my purse or into your pocket for your wallet and touch things, again, then you've put those germs onto those items. So even with gloves, you need to keep in mind that that protects your skin, but if you touch other items, you could contaminate them.
Well, Robin, this is all such practical, easy to do habits and information. So we appreciate you telling us about that and reinforcing with us the importance of good hand washing and reducing the exposure to cold and flu and any other sort of germs that are floating out there. It just makes life a lot nicer if we don't have to deal with these things.
It definitely does.
Well, I look forward to talking to you further. I hope you have the best holidays possible. And I appreciate what you do for the community with Wildflower Healthcare.
Thank you so much.
And
I would say if viewers found this helpful and would like to share the information with other folks, please do like, share, or comment.
thank you so much.
Mhm.
Well, I look forward to talking to you again. There are many ways that we can do good things for ourselves and for our community so that we're all a lot healthier. And I remember once in a movie, they said, your health is the one blessing upon which all other blessings rest. And we can take better care of ourselves without that much effort and make a
Absolutely.
big impact.
Mhm.
So thank you for what you do. Thank you for joining us today. And I look forward to talking to you again.
All right. Thank you.
Bye-bye.
Bye-bye.